A patient's family member paid 9,030 rupees for 4 blood tests at a reputed hospital, trusting the brand without question. Later, they discovered the exact same tests, at a franchise of the same hospital, were priced at 3,500 rupees. After insisting on a refund and getting a doctor's approval, they were reimbursed, but not without resistance. This sparked concerns about inconsistent pricing and opaque billing practices in Indian healthcare. Even well-meaning doctors can unintentionally become part of a system that erodes patient trust. Pricing inconsistencies and lack of transparency, even when doctors aren't directly responsible, reflect on your practice and your brand. Patients today are more informed. One bad billing experience can undo years of goodwill. Here are some actionable takeaways for doctors. Be transparent about costs. Before recommending tests, give patients a ballpark cost estimate. If possible, suggest affordable alternatives or labs you trust. This doesn't undermine your professionalism, it shows you care about the patient beyond just clinical advice. Build a trust-first practice policy. Encourage your clinic or hospital to display standard pricing openly. Push for clarity, even if you are not in billing. Suggest second opinions or cost checks if a patient looks hesitant. Ensure the credibility of labs and service providers you suggest. Evaluate third-party services before referring patients. Work only with verified and trustworthy diagnostic partners. If your hospital outsources or has lab franchises, know their pricing structure. Ask yourself, would I send my own family there? Stand with the patient in disputes. Like the doctor in this story who approved the refund, be a voice of reason when patients raise concerns. That simple gesture builds long-term credibility. Educate through your platform. Use social media, blogs, or your clinic's notice board to share patient rights and healthcare navigation tips. This positions you as a trustworthy expert. A doctor's reputation today is shaped not just by their skill, but by how they make patients feel. Fairness, transparency, and empathy aren't just moral choices, they're smart business strategies. Want more real-world business lessons to help your medical practice grow ethically, sustainably, and profitably? Subscribe for weekly insights and practical tips, designed for doctors, by someone who gets the business side of healthcare.